Hi, this is Dr. Tony Cooper, and this is Life Without Baggage. In this podcast, I'll help you develop a stronger sense of self, develop firmer boundaries, and also learn how to lean into the gentle promptings of the Holy Spirit who can help you navigate life. My purpose is to help you get free from the emotional baggage that weighs you down so that you can be fully alive and engaged in life. My media includes audiobooks, self-help books, videos, and this podcast. Just a reminder before we get into today's episode that this is not a substitute for medication or counseling. If you're having thoughts of harming yourself or another person, or if this material triggers you, please contact your doctor or a mental health specialist to help you with your concerns.
We all come to a point where we have to accept that what happened happened, and healing of sitting with it, grieving and accepting healing and accepting forgiveness, accepting grace, that process is really front loaded, but at the end is so worth it because now you're no longer living by what your parents said or what that perpetrator said or what that pastor said or what that friend said. You're living in complete freedom because you're only accountable to what God says about you, which is so much nicer than
Hmm.
what any other human being can say to you.
You just heard a clip from this month's episode of Life Without Baggage. So, this is season 5, and the episodes are dropping one a month. Today, my guest is Dr. Uejin Kim. She's a psychiatrist, and we're going to be talking about the interplay between psychiatry, mental health, the role of medication, as well as Dr. Kim's approach to treating people and helping them through the difficulties of life. So, let me read a little bit of information for you about Dr. Kim. Dr. Uejin Kim is a Christian psychiatrist, an entrepreneur, a podcast host, and a public speaker. More importantly, she is a wife, a mother, and a child of God. Dr. Kim is passionate about bridging the spiritual and mental health gap using her medical training, personal and clinical stories, and Bible stories. She shares her journey to understand and teach what it means to be emotionally, mentally, and spiritually accepted, healed, and free. So here's Dr. Kim. So thank you, Dr. Kim, for joining us today.
Thank you for having me.
So we have lots of questions about psychiatry. First, I want to ask you, how did you even get interested in becoming a psychiatrist?
Yeah, and that's an interesting story too because so my dad is a physician, and so he's family medicine practice. He has his private practice. So he said, "You're gonna be a doctor. You're gonna run my practice." And I was like, "Nope," So I wanted to be nothing else, anything but a physician. So every time I would have to, after high school, apply, or when I went to college and I had to be pre med, at every fork in the road, I would always entertain the idea of like, what else can I do? What else can I do? But it's just one of those moments that in these decision making points that God always made medicine make sense, other than other choices. So it's just kind of like being faithful, decision point one after the other. And in medical school, there's first 2 years is kind of like a book study. You're learning all about the systems, GI, cardiac, pulmonary. And then third year, you're rotating through all the specialties like surgery, internal medicine, pediatrics, family medicine, psychiatry. You're just getting like a buffet style taste of each specialty because at the end of third year, you kind of have to know, okay, this is a best fit for me. Personally, for me during third year, it was the worst year of my life because I had a lot of health problems going on.
Mm.
And my car, out of all places, El Paso, Texas, which is like a desert, my engine got flooded because I drove through the puddle.
Oh,
And El Paso didn't have like a good, reliable mechanic to fix it at the time. So it was just like dealing with insurance claim. I'll be done with the rotation, dealing with insurance claim, doctor's visits. So every rotation I hated. I was just kind of on a survival mode. And at the end of the year, I'm like, dude, I need to just at least pick one to apply to the residency. And I remember that throughout all my rotations, I gravitated towards psych patients. A story is like in surgery rotation, there was a schizoaffective, like schizophrenia patient that was paranoid and he kept on pulling out his NG tube, and it was driving the team crazy because he has to be a certain level to be discharged. And it was so bad that my surgery intern was like, if he pulls it out, I'm going to staple it to his head, and I'm like, what? And she was probably speaking out of stress, but for me, he trusted me. So after surgery rotation, which is like my least favorite rotation, I went after hours to put the NG tube back out or back in because nurse told me, hey, Dr. Kim, like he pulled it out. And that was like a moment of truth for me because I'm like, Eugene, you hate this rotation. You want to leave as soon as it's done. But if you go after hours, to help this patient. Maybe it's a calling, and I
Ah,
had autistic boy in pediatric clinic that I really connected with, cervical cancer diagnosis at OB-GYN, a cross-dressing man at colon cancer clinic, so I would just go, in my own time to like talk to them and be like, when did you start cross-dressing? Or does the makeup get heavier if you're, more stressed? Like these therapy questions, but I was just really naturally curious to really understand and really advocate for them. So that's how I landed to be a psychiatrist, and I would never go back.
yeah, it sounds like that this is the perfect fit for you. God can steer us towards what our destiny is, what's inside of us already, but it's funny sometimes we fight the process, huh?
Yeah. And just to add, I thought I was going to be like cardiothoracic surgeon, something intense, because like achievement was like how I found my worth. But during the third rotation, like in surgery, when I go into the OR, I always passed out.
Oh,
Like the smell, the intensity, I always pass out no matter what I did. And I was like, I think I'm allergic to procedures.
so that was a closed door.
Yep, it was the first rotation, and I was like, okay, I'm pretty sure that that's not me.
This isn't the one.
Yeah.
So I was looking on your website and you described your approach as acceptance, healing, and freedom. So do you want to talk about your approach so that people can understand maybe how you look at things?
Yeah, absolutely. Um, So, in my podcast, you and I talked that spirituality is not discussed at all in our training, right? And especially in psychiatry, I think there are so many things that we can do with medications and now new technology that there was no, I guess, room to do a lot of therapy, training, at least in my program, that therapy training and especially like spirituality. That's something that I kind of had to come to my own conclusion because me being kind of born again Christian since I was 17, going through my own trauma, with my faith and with God, and merging this understanding of psychiatry, there was one day that, as I was kind of going through my own trauma work with therapists and God was like, I'm such a huge part of your healing journey. If you don't share that with your patients, don't you think you're holding out on them?
Wow.
And I was like, wow, okay. So I was doing kind of like corporate psychiatry at that point. But I was like, I think private practice is like the only way that I can really explore and be free to do this. So that's why I started my private practice, so that I can, if people wanted to talk about spirituality and Christianity, then I could, you know, do it more freely than corporate psychiatry. But that acceptance, healing, and freedom, the kind of tag that I created was my own journey of, you and I talked about in my podcast, like living with guilt and shame and always looking out for what's wrong with me, or that something bad thing happened to me, or living with anger. There are just a lot of hodgepodge of he says, she says, and feelings unprocessed, right? And we all come to a point where we have to accept that what happened happened, and healing of sitting with it, grieving, and accepting healing and accepting forgiveness, accepting grace, that process is really front loaded, but at the end it's so worth it because now you're no longer living by what your parents said or what that perpetrator said or what that pastor said or what that friend said. You're living in complete freedom because you're only accountable to what God says about you, which is so much nicer than
Hmm.
what any other human being can say to you, right? So that's a true freedom, and he created you and you have specific gifts and purpose, and just finding fun in paying attention to yourself. And I think that's the vision that I have for myself, my kids, my husband, and anyone, my clients. So that really was a process that I went through, and it just kind of stuck to create like a path for my patient physician relationship.
Okay. So, you know, a lot of people, especially Christians, are afraid of the idea of medication, and not everybody needs it. But how do you determine if a patient really needs to try some medication?
A lot of times people come to me, give me that happy pill, make me feel
Oh,
better about myself, right? But I don't see it like that. I said, my goal for you, with or without medication, is so that you can accept yourself, be healed, and be free, right? And be resilient, take responsibility for what is yours, and let go of the responsibility that's not yours, right? And handle normal life stress and kind of know how to handle it, like strategize around stress, which is what we all have. So that's my goal for you. You might not need medications if you were able to do all of that by yourself. But if you need help, it's just like a 20% additional help so that it can kind of make you reach that goal for you. So I don't see it as, people see it as, oh, if I'm medicated, then I'm a failure, I'm weak. Actually, it's just your goal does not change. You're going to go to acceptance, healing, and freedom pathway, but medication is just a small part. And I use a lot of times like hypertension as an example. What if one person did everything right, low salt, exercise, and blah, 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 but their blood pressure is always 140 over 90? Would you say that they're a failure for taking antihypertensive medications? No. She's doing everything else, but she just needs a little bit of help. There's a lot of genetic loading, everything that is outside of her control. Versus if that person is obese, they're eating pizza and fries every day, they're high salt, drinking diet soda all the time, and their blood pressure is 110 over 70 is perfect. Would you say that that person has a successful healthy life? No. So my is it really removes the fear of medication or even the heaviness of discussion medication, because my goal for you does not change.
mhm.
Is to
Yeah,
try your best.
that's an interesting way to put it. That's very useful. That if you can't reach your goals without some assistance, that if your brain is just on overdrive
Yeah.
all the time, if you've inherited that tendency towards intense depression, you know,
Mm-hmm.
you're not going to be able to tough it out. That's what medication is for. It gives you that little bit of assistance, that 20%, so that you
Yeah.
can do the things that you want to do and need to do. But yeah,
Right.
unfortunately, some of us just inherit some tendencies that no amount of self discipline is going to fix.
Yeah. And or so, Dr. Cooper, biopsychosocial model, right? All the factors that goes into that, the factors that we can actually change is very small. We talked about how we were parented. It really is a driving force of the rules and rigidity that we have. And therapy is the cure for that. But to get to the to get to where our brain and our emotions can use therapy to undo the parenting that we received, that's the role of medication. Because sometimes we're over flooding all the time, with emotions, and there's an emotional roller coaster, then you can't do therapy because therapy takes a lot of attention, a lot of focus, a lot of stillness. So medication is gonna assist with therapy process because is going to bring down the intensity of roller coaster just a little bit so that you can really sit with your emotions and really process them.
That's great. I was going to even ask you that question. How do you see the role of counseling as opposed to the role of medication? Because this comes up a lot with people. Either they're so depressed that they have trouble implementing some simple suggestions, or their brain is so busy all the time, that like the almost OCD kinds of stuff, although it can be OCD, but where their
Mm-hmm.
brain never stops and just the same thoughts cycle over and over like a dryer. That's where you really need to talk to someone who can figure out what medication is going to slow that down so that
Mm-hmm.
you can function in a way that is not so exhausting.
Yeah, absolutely. Yeah, a lot of times the referral from psychiatrist to therapist and therapist to psychiatrist kind of goes both ways. I will start the medication and I'm like, ooh, there's a lot of trauma. I'm seeing the themes of how it's affecting you. And I do a lot of therapy with my patients. Like every touch we get, they get some therapy. But if I'm like, I think this needs more than once a month kind of therapy session with Dr. Kim, like, and affordability, right? And I don't think they can or they don't want to, pay for me like weekly therapy. Yeah, then I need to collaborate with a therapist, so that you're really getting hands on, intense therapy. Or the therapists are like, Dr. Kim, we did what we could with the depression, but there's still significant and is actually hindering the therapy process. Then I'm like, yeah, absolutely. That's an appropriate use of medication. I see this people, and I was like that too, where we're carrying that heavy backpack of all the burdens from our childhood. Our mind is racing. We're looking at all the things that's wrong with us. And sometimes, like for me, my style is like I take a vacation a week and I'm like, okay, let's go back. Let's go back to carrying the heavy backpack with mind racing and let's go back to the rat race again, right? And a lot of people, quote unquote, function like that. But then it's a good point to kind of say, time out. Where do you want to go? Can you do this for another 10 years? Like go crazy, rat race, mind racing, can't sleep, take a vacation and a breather, go back to it again. Like, how does that sound? So what if we can make a trajectory difference, like 2 degrees, to get closer to your goal and more sustainable mental health, sustainable spiritual health? Like, wouldn't that be a lot better than do this cycle of craziness over and over again?
So it sounds like you do more therapy with your patients than most psychiatrists, at least around here.
I believe so. And that is something that I'm appreciating over and over again is that, and this is based on my conviction that we're all spiritual beings and we're all broken and we have this intense desire to feel safe and significant. And a lot of times we all had imperfect parenting that didn't meet all of that. So we had to kind of conjure up a lot of rules and, what to do and SOPs in our lives to function. And medications cannot make you understand that. you know Medication is modulating biochemical imbalance, maybe being overly stimulated, maybe being easily stimulated or understimulated. This is what we can handle, but it's really the human to human connection. When patient says like, oh, I got bullied, and I'm like kind of categorizing, oh, I got bullied too. And even though I'm not telling my patients that, me sitting with that heaviness of like, yeah, that sucks. You know, that's what my patients needed, is somebody to say, you're not crazy. Given what happened to you, this is actually pretty appropriate. Like,
Yeah.
this is an appropriate response.
Yeah.
And I think that's the touch of healing that I want to give, because without that, we're just passing out meds. We're not making connection. We're not being humans. And so in a sense, I say therapy, but it's really using what I know to be present and connect with them.
So how would you explain to a person the difference between what the family doctor can do and what a psychiatrist can do?
That's a really good question because we are in a mental health crisis and there's not enough psychiatrists to go around. So, family medicine doctors are kind of jack of all trades, if you will, in an outpatient setting. They can manage a lot of different systems and they are your go to because they can see how different issues like diabetes or, heart attack can kind of overlap and they manage the overall health. Um, I'm sure they had some rotations in psychiatry where they feel comfortable with prescribing maybe one or two medications. Um, but usually I say if your family medicine doctor or primary care provider made some changes, like maybe one to two medications, and it's not getting better, or if you feel uncomfortable with how he's changing medications, then it's probably time to refer out to a specialist. So for us, we had some touch and go with emergency medicine, internal medicine during our first year, but the rest of the training, like 3, 4 years, we did just psychiatry. So that's where the power is, where we're like, oh, with this symptoms, irritability with depression, we use this medication. That it really becomes an art form of psych medication. So after 2 or 3 changes, I would say you need to see a specialist.
Okay, that's a good rule of thumb. I also find that clients who have a lot of health issues on top of anxiety, or they have
Mm-hmm.
ADD and anxiety, it's like family doctors want to help, and some of them just have a knack for it. But when you're getting into all these different moving parts that are working
Absolutely.
against each other, you really want someone whose expertise is this medication is going to be a good match for you. And
Yeah,
this, and we don't want to like over prescribe for something that's going to cost you someplace else. And a
right.
psychiatrist, that's your specialty. That's what you know.
It's not just treatment, it's diagnosis. So a lot of times people are like, I have mood swings and I'm irritable. Well, then you're bipolar. Or, oh,
Uh,
that sounds like, but actually, irritability is a DSM criteria for multiple diagnosis. So you want to dig deep into what kind of irritability, what triggers your irritability. Is there a trauma? So you really want to go dig deep into the symptomatology to get the right diagnosis because if you don't, then you're on wrong meds with wrong diagnosis just because you said you have mood swings and you got arrested by punching your wife and you're irritable. Well, that sounds like snapshot mania to me, but if you dig a little bit deeper, it could be PTSD, it could be really bad depression, it could be explosive, anger disorder. So you really have to dig deep into symptomatology.
yeah, that's a good explanation because I think sometimes people are afraid or they think it means you're crazy if you go to a psychiatrist, but you're tapping into someone's expertise that is going to see what fits and what doesn't because I do find a lot of people have been misdiagnosed. If they go through something, it's automatically labeled as PTSD, and a lot of times it is not PTSD. They're just anxious, which
Mm-hmm.
makes sense. Behavior always makes sense, but sometimes, and I also find, there's like trends in the culture of what everything gets diagnosed as this for a while, and then
Yeah.
everything gets diagnosed as that. And that's not going to happen with a psychiatrist.
And I hope not. I can't speak for everyone, but for example, too, there's these little fads like, oh, I'm like ADHD because I can't concentrate. Something that I've seen a lot now, and I'm so anti social media fad and like relabeling things. But burnt out brain has very high distractibility in attention and forgetfulness, right? And we go through it. If I'm stressed out, I can't concentrate. If I'm stressed out about something and it's like a really hard season, then I forget my passwords, to my laptop. It's appropriate. It's not healthy, and I don't want to stay there. But if you're always stimulated by social media, YouTube videos, and what the, PTA said about your kid and blah, 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 like these things get stimulated and we don't ground ourselves, we don't have a break respite from that, then you're gonna have ADHD symptoms, and
Okay.
I think we kind of have to step back, and as a child psychiatrist, like you have to have these symptoms as a child for you to really have true ADHD. But I'm getting a lot of ADHD consult requests, and they were perfectly fine as a child, but now they're getting more and more ADHD symptoms. Then I kind of have to be like, what's your stress level? Like how do you think? And maybe it was an underlying anxiety, performance anxiety that now is kind of playing out. So.
That's really interesting. So you're saying that a lot of things get misdiagnosed as ADHD, especially in adults,
Yeah,
that
so
that is it's really anxiety.
yeah, anxiety or insecurity that you have to fulfill, and I have to do this, I have to do that. If you're thinking like that in your head, that's that's an engine that keeps on running and it doesn't stop and it's gonna misfire. So I can't say that all of them don't have ADHD because a lot of times, adults get diagnosed because they didn't treat the childhood ADHD, but it is so important to do a full intake. It's not just like a TikTok video, oh, that's me, I have ADHD, right? You have to kind of go back to last 30, 40 years of what's been going on.
Yeah. I shouldn't laugh because that is how a lot of people,
It
diagnose
is, yeah.
themselves. It's like I saw this on TikTok. You brought up a really important point that I don't think I've ever addressed or any of my other guests, but what would you say about how much people are trying to juggle and think it's normal?
I guess there's two things. When people say, this is my normal, I always say, well, is it sustainable? Because it doesn't matter how normal it is. If it's not going to be sustainable and you might kill yourself doing it, do you want that? Right? And that even goes to not even things to juggle, level of resentment because you're not taking care of yourself. I had to deal with that in my marriage where I was waiting for my husband to step up and take care of me. But God was like, how can he take care of you if you don't take care of yourself and you're an adult? You know? Um, and I was like, okay, so I might have to let go of some things that I'm juggling to really take care of myself, right? The level of resentment and bitterness because we're looking for a sense of significance and safety from other people. That's not sustainable. It wasn't sustainable for me. Um, and do you want to make that normal, And the second thing is kind of like piggybacking to what I said is all the things that you're juggling, is that really you? Like, did you choose that? Or do you think maybe that's a good idea because this person on TikTok or this person on Good Morning America said it and I'm going to add that to my routine, right? So not losing yourself because of all the opinions that you're hearing. So I think that's kind of where it comes to like the acceptance, healing, and freedom is that true freedom of juggling what you want to juggle and not juggling what you don't want to juggle and making sure that you're sustaining your life in a sustainable way, um, and letting go of people's expectations and setting your expectation of yourself, and I think that's the freedom that I want everybody to have, even to my worst enemy. I want them to have that level of freedom and find their identity that's true to them.
So you brought up something a minute ago. You've answered the questions on medication really well. So I don't know if we
I
need
passed the
to,
test.
well, I don't know that we need to like belabor that because I think you
Yeah.
addressed those concerns and the fears and how it all fits together. But you mentioned something about women can have a lot of, I think women especially can have a lot of resentment because
Mm.
they're wanting somebody to change instead of examining their own personal responsibility. Could you address more about taking responsibility for yourself and having reasonable expectations in your close relationships?
I'm a high performer, and as women, we had to outperform to kind of match the productivity level of our male despite our obstacles. And naturally, I'm a very type A person. And my gift is producing things, like executing, plans. But my husband, he's very patient and gentle and meek. That was his strength. So on the outside, I was taking care of everything and he's just kind of, having fun and, being patient with people and stuff like that. And um, I was getting so frustrated, and it took a lot of steps for insight for me to gain that we're not created equal. Like my strength is his weakness, his strength is my weakness. So there's a lot of to unpack there. But I was like so frustrated. I was like, God, like he's not doing this and he's not doing that. And I think Holy Spirit was like, Eugene, I know that you're carrying a lot. And yeah, it is frustrating that he's not producing your results, like outwardly results. But do you also know how hard it is to live with angry wife? And I was like, oh my gosh. So there's that unseen burden both ways. And communication and connection really makes it even where it's no longer this is my turf, this is his turf, this is my responsibility, this is his responsibility. It's less on that. So let's say that mine is folding laundry, doing laundry. If I'm like, Nathan, I really don't want to even touch a single fabric, like I'm so sick of it. Can we just switch? Yeah, absolutely. That communication connection, like I got your back no matter what. That's what is needs to happen in marriage. But to get there, I mean, I had a lot of fights. There's a lot of close calls, and we've been married for 10 years. But I think finally we're getting to the point where I had a lot of expectations of myself that I brought from my childhood. And
Sure,
he did too.
sure.
So that acceptance, healing, and freedom, I had to be free from expectations that I was living with my whole life, where wife has to do this, mom has to do this, or now I'm a working mom and my mom thought she didn't want to be a working mom. Like all these ideologies, I had to be free where I'm like, I want to be a working mom and I want to do this, right? And so this is my needs, this is his needs, this is my strength, this is his strength. How can we marry this together? That really got rid of the bitterness because at the end of the day, I didn't want him to do everything and make me feel great because my feeling is not his goal. Is I wanted to be understood and I had to understand myself first to tell him this is how I feel. So that responsibility was not just more to do, but it was let me share some of my attention and love and grace to myself so that I'm not expecting all from another person.
Yeah, yeah. Thanks so much for sharing that personal example.
Yeah.
I think it resonates with a lot of people, women especially. So you've given us a ton of useful information and things to consider. How can people learn more about you, Dr. Kim?
So I have two websites. One is restorepsych.com. That's my private practice. And I have eugenekim.com. That's my educational platform where there's podcasts, public speaking, and now online course that's going to be
Okay.
launching in spring of 2025. So that you can kind of do self therapy and self introspection in your spiritual inner child. So I'm really excited about that. So keep a lookout.
Wonderful. Thanks so much for answering our questions. I'm voicing the questions of a lot of people today, and I just appreciate your sensitivity to the psychological and the spiritual elements of wholeness. So, God bless you in your work and in your new endeavors for 2025.
Thank you so much, Dr. Cooper, for having me.
Thanks for listening, especially all the way to the end. This is Dr. Tony Cooper, and this is Life Without Baggage. If this helped you, share it with a friend, and please send me any questions you have if there are things you would like me to cover in future episodes. Talk to you next time.